Hyperthyroidism. It is extremely deadly. It's not that common, but it causes a whole host of problems. In this video, I'm going to show you the causes, the symptoms you should look for, and how to diagnose this, and ultimately what you can do about it. And we're going to get started right now. Well, hello everybody, I'm Dr. Glenn Harrison, and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my clinic every day. So the question today is all about hyperthyroidism. Hyperthyroidism versus hypothyroidism are significantly different. They're opposite ends of the spectrum. Hyperthyroidism is where your thyroid is performing too well, if you will. There's too much thyroid hormone in your body and everything starts to speed up in your body. Hypothyroidism are the more common forms of thyroid disorders, the vastly more common. I think it's about 95% of all thyroid disorders are hypo, where everything is low and everything is slow. So I've talked a lot about hypothyroidism in the past. I've even done workshops on it, and they're all over the website. But I want to put a little emphasis on hyper, because this is a very, very dangerous disorder. In fact, it can actually even be deadly. So that's why we're having this conversation. So that's really what hyperthyroidism versus hypo. And there's only, I believe, 1 in 100, I think it's 1 in 100 Americans that are actually suffering from hyperthyroidism. So it's not that common. But don't underestimate, in my clinic, I just had one the other day and it was very, very serious. It needed serious medical intervention. You know, it was almost an emergency, really. So I want to, let you understand this, so maybe it's related to you or friends or loved ones, or maybe even had a diagnosis of it. So the most important thing, I guess, to start off with is the common symptoms. I understand people aren't going, everybody's going to the doctor and getting thyroid tests all the time, but some common symptoms to see if you are maybe potentially dealing with a high thyroid or a hyperthyroid symptom or disorder. A common one is heart palpitations. So if you feel like your heart is beating much faster than someone else, if you have a hard time to put on weight, so hyperthyroidism, everything is speeding up, so it's harder to hold on to weight. Now there's exceptions to these symptoms, of course. Some people can be hyper but have a hard time to lose weight. I'm giving you the common ones. So hyperthyroidism, inability to lose weight, that's one. Again, heart fluttering and heart palpitations where everything's moving faster. Nervous, easily agitated, inability to sleep, stay asleep. Sweating, feeling kind of clammy skin and sweating more. Then there's digestive issues too. Increased gastric motility. So sometimes people have diarrhea. Even digestion moves faster. Anxiety is associated with it. There's a lot to it, but these are just some of them. There can be many more. Like in females, there can be menstrual irregularities. Everything is, again, moving very, very fast. Anxiety and nervousness are also classic hyperthyroidism. So these are some of the common symptoms that you can look at. There's also some other ones that come up, and people can have tremors where they have bizarre tremors, and it progresses over a period of time. So those are some of the common symptoms that you can kind of look at. Now, it all comes down to the causes. What could cause this disorder? Well, there's 3 major causes, if you will. The first one is I guess to understand the causes, first we need to understand what normal thyroid function looks like and how it works. So the thyroid, of course, is that gland in our neck, and the thyroid should only get a signal, should only be stimulated from our brain. The brain does the stimulation. Nothing else should tell the thyroid what to do. And this form of stimulation is a hormone called TSH, thyroid stimulating hormone. So the brain should send that signal. The thyroid should produce, normal amounts of T3 hormone and T4 hormone. These are thyroid hormones. That's normal. But with hyperthyroidism, something went wrong. So one scenario is where people can actually have pituitary tumors. So the pituitary is part of the brain, and you can have a tumor that's part of the pituitary, and then you end up with too much thyroid stimulating hormone. So that's one scenario, and that has to be ruled out with an MRI or a CT exam, a picture of the brain. And then another scenario is you can have nodules on your thyroid that are toxic nodules, meaning they give off hormone. So your brain's might only be stimulating your thyroid so much, but your thyroid has this nodule and it's radiating extra hormone. So those are two scenarios of it, and they're very dangerous and they should be ruled out by your doctor. And then there's a third one, which is the most common form and cause of hyperthyroidism, vastly the most common, and that is an autoimmune disorder called Graves' disease. I'll talk more about Graves' disease in another video, but this is where the immune system comes in and intercepts the thyroid and stimulates your thyroid. It's actually your immune system doing this, stimulating your thyroid when, remember, just the brain should be stimulating the thyroid. So you have your immune system doing this. So Graves' disease is an autoimmune thyroid disorder that results in high thyroid function, and it's the most common cause of all hyperthyroid disorders. So it's serious, and again, as I'm saying, hyperthyroidism, whatever form of it, it can actually be dangerous and deadly because it can cause strokes and heart attacks. It really can. It can put a massive metabolic demand on the entire body, creating very, very dangerous scenarios. Okay, so don't take it lightly if you have this. Make sure you're working with your medical provider on this. But those are the causes of it. And to differentiate it, of course, you got to take pictures of the brain, make sure pictures of the thyroid, make sure, and then do the testing. And if those are clear, you should have two tests to rule out Graves' disease. It's a blood test to rule out this autoimmune disorder. There's one called, and you got to do both. I have seen some people only do one of these tests, and they said, oh, they don't have Graves. And then the doctor's reports say, well, we kind of don't know why they have hyperthyroidism. I'm like, well, you got to do both. So you got to do both. One's called TSI, thyroid stimulating immunoglobulin. That's one. And the other test is called thyrotropin receptor antibodies. So you got to do both of them. And if you don't do both of them, you could miss one and then maybe not have the proper diagnosis and miss that it's an autoimmune disorder. So you do both of them and you rule it out. But that's the hierarchy of diagnosing these things. So what if? What if you have hyperthyroidism? Preferably you have medical management. Don't avoid the medical system with this one. This is dangerous. Okay, ruling out that. And if Graves is determined, if it's an autoimmune disorder, medical management is still necessary. Some management is medications to start destroying or inhibiting thyroid function. And then another, and that's kind of the main one. And then the other one is surgery, where there's thyroid removal, and then you need thyroid medication to replace this lost gland. So you need medical intervention. But if it is an autoimmune disorder, which vast majority are, you need more than medication for this, because if you have one autoimmune disorder, and I've talked about this in other videos, if you have one autoimmune disorder, there's a 50 to 60% chance you could have another one. And there's a lot of really nasty autoimmune disorders out there. And so you're going to want someone to look at the whole picture and start looking at your immune triggers and things like that. And if you're looking into that, watch some of my content or start searching and understanding and learning about autoimmune disease and how to manage it. You can't cure it, but you can manage it. So anyway, I hope this was helpful. If you have any questions, feel free to leave them below. I will answer them. And I look forward to talking to you next day, where we're going to answer the why to another health-related question. Have a great day.